Catherine Garcia here today, and we are talking about the simple extraction procedure. First, we are starting off with our tray setup. First, we have our basics, which is the mouth mirror. This is used to retract cheeks or lips. Then we have our three-way air water syringe. This is to compress air or water, or combination of both. Then we have cotton pliers. This is to transfer materials in or out of the mouth. Then we have our Explorer. This is used to check for calculus. Then we have our syringe. Then we have our topical anesthetic. This is to numb the area for the procedure. Then we have our 2x2 gauze. Then we have our HVE tip. This is to remove large amounts of debris or saliva. Then we have our saliva ejector to remove saliva from the mouth. Then we have our periosteel elevator. It's to get around the tooth and loose its periodontal ligaments. Then we have our elevator. It's usually straight. This is to lift and remove teeth. Then we have our forceps for upper or lower extraction. Then we have our surgical curette. This is used to scoop or for excavation. We can only keep our instruments exposed for a matter of 60 minutes. Anything longer, they are considered not sterile, and we will have to use new ones. A simple extraction is a straightforward forceps type of extraction. First, we will see our patient. We will review its medical history, if they have any heart problems, if they're taking any medications or medications that were on the history that they might not be taking anymore. Make sure to take them off. Then we will explain our procedure, answer any questions or concerns. We will sign the consent form. Then before starting the procedure, we will take the vitals. Then we will discuss the post-operative instructions before and after treatment. First, we will place the topical and local anesthetic. The doctor will use an explorer to check to make sure the patient is numb. It will poke on the gums on the surgical side to see if they are numb. The explorer he will be using will be this one right here. Then he will use a periosteel elevator to make room under the gum line to detach ligaments of the tooth. An elevator will be used to loosen the tooth. Then we will use a forceps to remove a tooth in one piece. The doctor will look at the tooth and make sure it is intact. Sometimes a root tip can chip off in the process and be left in the socket. If it is, we will need an x-ray and it must be removed. A surgical curette may be used using the surgical aspirating tip to suction any debris from socket. We will make sure that the doctor is okay with this. Some doctors prefer for the blood not to be disturbed. Myself or the doctor will fold a 2x2 gauze and place on the extraction site and instruct the patient to bite the pressure for at least 30 minutes. An extra gauze will be given to the patient in case they need to change it. Make sure the patient swallows their saliva. Sometimes they get scared thinking some chemical will go in their mouth. Then we sit the patient up slowly and we repeat the post-op instructions and give them to the patient in writing with extra gauze. If the patient feels okay and not dizzy, they can be dismissed. It is okay to follow up with the patient the next morning to make sure they are doing okay and not have any discomfort.